What are focal versus generalized seizures in epilepsy? Imagine your brain as a busy city with many neighborhoods. Seizures are like power surges that can start in one neighborhood or affect the whole city at once. Understanding the difference between focal and generalized seizures helps doctors figure out the best way to treat epilepsy. Focal seizures start in a specific part of one side of the brain. They are also called focal onset seizures. If someone has a focal aware seizure, they stay conscious and aware. They might feel unusual sensations like tingling, see flashing lights, or experience a sense of déjà vu. Sometimes, these seizures are so subtle that others might not notice them. On the other hand, focal impaired awareness seizures cause a change or loss of consciousness. During these, a person might do automatic actions like lip smacking, picking at clothes, or wandering around without knowing what they are doing. These seizures can sometimes spread from one part of the brain to both sides, turning into a generalized seizure, which involves the whole brain. Generalized seizures involve both sides of the brain from the very start. They are called generalized because the electrical activity spreads across the entire brain quickly. These seizures usually cause symptoms affecting the whole body and often lead to loss of consciousness. One common type is the absence seizure, which looks like a brief stare or unresponsiveness that lasts only a few seconds. People may not even realize they had a seizure. Myoclonic seizures cause sudden jerks or twitching in muscles on both sides of the body. The most well-known are tonic-clonic seizures, which start with stiffening of the body called the tonic phase, followed by rhythmic jerking called the clonic phase. During these, the person usually loses consciousness and may fall or convulse. The main differences between focal and generalized seizures lie in where they start and how they affect awareness. Focal seizures originate in one specific part of the brain and may or may not affect consciousness. Symptoms are often localized, like twitching or sensory changes. They can sometimes spread and become generalized. Generalized seizures start across both hemispheres at once, affecting the whole body and usually causing loss of consciousness. They tend to have more widespread symptoms like convulsions or staring spells. Knowing whether a person has focal or generalized seizures is crucial for treatment. Some medications work better for focal seizures, such as carbamazepine or lamotrigine. Others, like valproate, are more effective for generalized seizures. Diagnosis involves a detailed clinical history, an electroencephalogram or EEG, which records brain activity, and sometimes brain imaging like MRI. Video recordings of seizures can also help doctors see what happens during a seizure. Understanding the type of seizure helps guide personalized epilepsy care. It informs prognosis and helps choose the most effective treatment plan. If you or someone you know experiences seizures, it is important to see a healthcare professional for proper diagnosis and management. Every person's experience with epilepsy is unique, and tailored medical advice is essential for safe and effective care.